Practice realistic CCMA 3.0 certification test questions with step-by-step video explanations. Question 1. What does the medical abbreviation SOB commonly indicate? Shortness of breath, swelling of the abdomen, severe abdominal pain, stiffness of the back. SOB is an abbreviation commonly used to represent shortness of breath. Ascites refers to the abnormal accumulation of fluid in the abdomen and is not represented by the abbreviation SOB. Colic typically refers to severe abdominal pain, but it is not represented by the abbreviation SOB. Stiffness of the back is unrelated to the abbreviation SOB. Question 2. Which of the following is the correct order of the chambers of the heart through which blood flows after returning from systemic circulation? Right atrium, right ventricle, left atrium, left ventricle, left atrium, left ventricle, right atrium, right ventricle, right atrium, left ventricle, left ventricle, left atrium, left ventricle, right ventricle. After returning from systemic circulation, deoxygenated blood enters the heart through the right atrium. From the right atrium, blood flows into the right ventricle, which pumps the blood to the lungs for oxygenation. Oxygenated blood returns to the heart through the left atrium. From the left atrium, blood flows into the left ventricle, which pumps the oxygenated blood to the rest of the body. Question 3. Which of the following structures is the primary structure responsible for the production of red blood cells? Spleen, lymph nodes, bone marrow, thymus gland. The spleen plays a role in filtering the blood, storing red blood cells, and producing some types of white blood cells, but it is not the primary site of red blood cell production. Lymph nodes are involved in filtering lymph and activating immune responses. The thymus gland plays a role in the development and maturation of T lymphocytes, a type of white blood cell. Red blood cells are primarily produced in the bone marrow, specifically in the spongy bone marrow found in the center of bones. Question 4. Which of the following methods is used to administer medication through the skin? Inhalation, intravenous, sublingual, topical. Inhalation involves breathing in medication through the respiratory system. Intravenous administration is the direct delivery of medication into a vein. Sublingual administration involves placing medication under the tongue for absorption. Topical administration involves applying medication directly to the skin. Question 5. Which of the following is the correct sequence of steps for hand washing? Wet hands, apply soap, rinse thoroughly, dry with paper towel. Dry hands, apply soap, rinse thoroughly, use hand sanitizer. Wet hands, use hand sanitizer, apply soap, rinse thoroughly. Wet hands, apply soap, rinse thoroughly, use hand sanitizer. Wetting the hands first helps to create a lather with soap. Applying soap helps to remove dirt, germs, and other contaminants. Rinsing thoroughly under running water removes soap and debris. Drying the hands with a paper towel helps to remove any remaining moisture. Question 6. Which of the following positions is commonly used for examining the chest and lungs? Supine position, prone position, lithotomy position, Fowler's position. The supine position is lying flat on the back. The prone position is lying flat on the stomach. The lithotomy position is used for gynecological examinations. Fowler's position is a seated or semi-seated position with the head and upper body elevated, commonly used for examining the chest and lungs. Question 7. Which of the following is the correct technique for measuring blood pressure using a sphygmomanometer and stethoscope? Inflate the cuff until no sound is heard. Place the diaphragm of the stethoscope over the brachial artery. Deflate the cuff at a rate of 10 to 20 mmHg per second. Measure blood pressure immediately after the patient has exercised. When measuring blood pressure, the cuff should be inflated until the radial pulse is no longer felt, not until no sound is heard. When deflating the cuff, it should be done at a rate of 2 to 3 mmHg per second, not 10 to 20 mmHg per second. The diaphragm of the stethoscope should be placed over the brachial artery, not the radial artery. Blood pressure should be measured after the patient has been resting for a few minutes, not immediately after exercise. Question 8. Which of the following is an example of a medical assistant's responsibility related to medical billing and coding? Assisting with wound dressings, updating patient demographic information, verifying health insurance coverage, performing electrocardiograms, ECGs. Assisting with wound dressings and performing electrocardiograms, ECGs, are clinical tasks typically performed by medical assistants. Updating patient demographic information is an administrative task that ensures accurate records but is not directly related to medical billing and coding. Verifying health insurance coverage involves confirming a patient's eligibility, coverage limits, and any pre-authorization requirements to ensure accurate billing and coding practices. Question 9. You receive a call from a patient who wants to reschedule their upcoming appointment due to a scheduling conflict. What is the most appropriate course of action as a medical assistant in an administrative role? Inform the patient that rescheduling is not possible and suggest they try to rearrange their schedule. Check the provider's schedule and offer the patient alternative appointment times based on availability. Offer the patient the next available appointment without confirming availability with the healthcare provider. Ask the patient to call back later as you are unable to assist with scheduling changes. Option A is not the most appropriate response as it does not accommodate the patient's request and may not reflect good patient-centered care. Option B is not the best course of action as it is important to ensure appointment availability with the healthcare provider before offering an alternative. Option C is the most appropriate response. As a medical assistant, you should check the provider's schedule to see available time slots and offer the patient alternative appointment options that align with the provider's availability. Option D is not recommended as it does not address the patient's request and may leave them feeling unsupported. Question 10. During a phone call with a patient, you encounter a language barrier as they do not speak English fluently. What is the most appropriate course of action? Speak loudly and slowly to ensure the patient understands. Use complex medical terminology to expedite the conversation. Seek assistance from an interpreter or a language translation service. End the call and ask the patient to come in person for further communication. Speaking loudly and slowly may not effectively overcome the language barrier and can further confuse the patient. It's important to use appropriate communication strategies. Using complex medical terminology can exacerbate the language barrier and hinder effective communication. It's important to use clear and simple language. Seeking assistance from an interpreter or a language translation service ensures accurate communication and facilitates understanding between the patient and the medical assistant. Ending the call and asking the patient to come in person may inconvenience the patient and delay necessary communication. Exploring alternative communication methods is preferred. Question 11. Which of the following principles is associated with the concept of patient autonomy? Beneficence, non-maleficence, veracity, informed consent. Beneficence refers to the duty to act in the best interest of the patient. Non-maleficence refers to the duty to do no harm to the patient. Veracity refers to the duty to be truthful and honest with the patient. Patient autonomy is the right of the patient to make decisions about their own healthcare, and obtaining informed consent respects this principle.